are here today, March the 15th, at the Baton Rouge Free Clinic. This is our second clinic. Hopefully this is going to become an annual event. So what we're doing here in the building today is we're providing free vision, dental, and medical services to anyone who shows up on a first-come, first-served basis. So we have a lot going on in the room. We have dental going on behind us where people are getting their teeth cleaned, they're getting fillings, they're getting extractions. We have medical triage going on where we're checking people to make sure they can have vision and dental services. And over here to our left, we're gonna have our vision and our lifestyle center. So we have massages going on, haircuts, we're providing meals for people that come in. Do wanna give a shout out to my sponsors, my major sponsors for this event. Louisiana Healthcare Connections, Healthy Blue. We have the Baton Rouge Airport, the City of Baton Rouge, Mayor Sharon Weston Broome, yours truly, Councilwoman Donna Collins Lewis. We have Entergy, AmeriHealth Caritas. We have Walmart. I know I'm going to miss somebody. Bontown and Associates, Murray and Murray Law Firm. But we're going to come back and add all of our sponsors because we're going to give a big shout out because even though this is a Baton Rouge free clinic, it is really not free. So we have a lot of sponsors that came out to partner with us to make this happen. They provided in-kind services such as food, free equipment, just an array of services that we could not have done without our volunteers. So we probably have had about 200 or 300 people to come through the clinic already. It's probably just noon, and we probably have several hundred more in the line. So we'll be doing this all over again in the morning from 7 a.m. until 7 p.m. We hope that we can serve, before the clinic is over, more than 1,000 people. So we're just running around, busy doing everything. I want to thank you to all of our hundreds of volunteers that showed up. Probably in the building around the place, we probably had about 400 or 500 volunteers that showed up. We'll have the same number tomorrow. So we have a lot going on. It's been a wonderful day. The rain has stopped. We were a little weary about the weather early, so all that's been taken care of. I'm standing right here in front of my Love Heals balloon because our theme for our clinic is Love Heals. So we're grateful for all the people that have come out, our doctors, our dentists, our nurses, all of our medical professionals, our volunteers, because without them, this clinic could not happen. So today you're seeing love that's truly healing a community, providing services that people might not have otherwise been able to get because of the lack of insurance or just their affordability. So again, we're here doing the Baton Rouge Free Clinic, our first day, and so we're looking for another great day on tomorrow.
Hi, this is Mayor Sharon Weston Broome, and I'm out at the Love Heals Free Clinic that is being sponsored by Councilwoman Donna Collins Lewis, CDI, and one of the major sponsors of this event is Louisiana Healthcare Connections. You know, I have been around here talking to a lot of the volunteers, looking at the dentists doing their work and people checking in, and it really speaks to the need of access to health care on a consistent basis. And with Louisiana Healthcare Connections, I know that you all are committed to access, to outreach, and Marcus Wallace, of course, is the medical director for Louisiana Healthcare Connections. Thank you so much for your sponsorship.
Sure, thank you. And this is a great event to help our members and people from around the state and the area to get the preventative services they need. We have vision checks, we have dental, we have blood pressure screenings, blood sugar screenings. It's a great way for people to get the access that, one, they're not aware of all the time, and two, to help, again, prevent them from ending up in the emergency room or the hospital.
Now, you said a very key word, preventative health care. Our goal as policymakers, as folks in your space, as healthcare professionals, has to be focused on educating people around preventative health care. Here in Louisiana, we have so many folks who are suffering with chronic diseases, and a lot. We can change those outcomes. That's the issue. We can change those outcomes with preventative care. So that's why these screenings are so vital today.
Correct. And I think a big part of it is education. You don't know what you don't know.
Exactly.
So when people come into this clinic, they understand they have to follow a good diet. They understand they have to take medication to keep their blood pressure or blood sugars down. Last year, I had one individual who had a blood sugar over 500, was on the verge of ending up in the hospital. We got him the care that he needed. We figured out what medications he was on and prevented him from getting in the hospital and tied him into a primary care physician, which he hadn't seen for months. So those are the kind of success stories we get out of this clinic and the kind of way that we help engage our members to get the care they need to stay out of the hospital.
That's a wonderful success story. And the truth is that before these 2 days are over, we'll be chronicling, and I know Councilwoman Lewis will have a list of testimonies of success stories of people who have come to this free clinic. And I've said, Marcus, that I love the theme of the clinic, Love Heals. And the truth is you cannot have a good quality of life if you're not healthy.
That's correct. I mean, you don't feel well if you don't eat well and you don't exercise and you're not taking care of your body. So if you do all those things, you have a better quality of life.
Absolutely. And I'm going to put in a little personal plug here. Last year, as many people know, I went on my own personal health journey trying to change the trajectory of my life and my outcomes by losing 35 pounds.
Wow.
And I tell people that you have to find the path that's right for you, but don't wait. Don't wait till, you are faced with a crisis situation, and the more preventative measures we can take, the better outcomes we'll have.
That's correct. And always remember, it's not short-term, it's long-term goals that you have to focus on. It's a marathon, not a short race. So stay healthy all your life, not just tomorrow or today.
And I think that sums it up. Thank you so much once again for your sponsorship, your commitment to this free clinic. And we know that success stories are going to come out of this event today and tomorrow.
Thank you.
What brings me here today, I love giving back to the community. Serving patients is like one of my passions, just giving back to the community. I love it. So that's why I'm here today. It is important because we have a lot of patients that don't have access to care, and we're here to not only provide a service, but give them resources after they leave to have these services out in the community, whether they have insurance or they're uninsured or underinsured. We have places that we're referring them to as well. Yes, we have physicians, physician assistants, we have nurse practitioners that are volunteering. They're coming in, they're giving their expertise, and they're taking care of our patients. We love it, and we're here for them.
I'm here because I support your mission. I also support the vision that this is such an important thing to everyone in our community, right? Because healthcare is something that everybody should have access to, regardless of their status in life, regardless of how economically stable they are. And this is just so important that we all need something like this because it's human rights, essentially.
Great. And so we have another one of our sponsors. You see my great table here, the YWCA, one of our major sponsors. I know I'm going to forget people, but this is just a great community event with a lot of great community partners that came out to make this happen. We got our WellCare over here, some healthcare providers that are looking to help people out that don't have insurance. And one of the major goals of this clinic is not just for today and tomorrow to provide services, but to connect everybody that comes through that door with ongoing healthcare services. We know we can't do this every day for free, but we are going to try to do everything that we can to connect people to services so they can have the ongoing healthcare that they need. So again, great community event, great community partners, and we'll be back doing this all day today and tomorrow. So thanks.
The main reason we're here today is to give back to the community. My specific role is Director of Pharmacy at the clinic, and I'm responsible for setting up the pharmacy on location so that we can actually fill prescriptions that come from the dental side and the medical side. It's really important to give back. just realizing that there's a situation where it'll come a point in time where everybody will be a situation in need. The community needs it. Just being able to be supportive and loving and give back, it's a blessing. In order to put on an event this large for 2 days, 12 hours a day, just the planning, preparation, and the volunteers needed is a large number. And it's just a great feeling to see how successful things have turned out.
We are doing a free screening with Mary Bird Perkins for the community, trying to get people out to take better care of their health. We're seeing a lot of people today that normally wouldn't be served. We've had lots of response for this event. They're trying to do it every year, and hopefully will help the community. We like to help people, and this is one of those things that's instant gratification. We know at the end of the day we've helped someone kind of take charge of their health. Also, a lot of times with mammograms, women are worried about their breast, and it's kind of a personal thing. So this way they can help themselves, we help them, and at the end of the day we know we've done something really good for them.
Oh, I'm just excited to be here. I'm coming out here for this free clinic for the people of North Baton Rouge, and everybody else is included. But today we're with the mayor's initiative, Go Get Healthy, and we are looking to help our community get healthy and stay healthy. So outside there's a table, and there's a order form for our top box. And so you can order boxes of fresh vegetables and fruit, and there are locations that you can go to get them picked up. They do take the EBT card as well as cash and credit. And so we're hoping that since we have 30% of convenience stores in our communities, that we are not providing fresh fruit and vegetables, we'd like to be able to have that accessible to the community. And so with that, we also have a community garden out on Winburn, at the Winburn Park. And so we are growing vegetables and fruits for our community, teaching them how to grow gardens at their own homes, and they can come out and nurture the one that's on Winburn in the garden at the garden park. We also have the top box that I just mentioned, and we have the Grow Baton Rouge, which is a bus, a green bus that's going around selling vegetables and fruits, very, 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 very reasonably priced. The services being provided today, thank goodness for our Councilwoman Donna Collins. She has provided, this is the second annual year, and they are coming out. They can get their eyes checked, they can get their ears checked, they can get glasses. They're also having dental work done, or examinations for the dental work, and blood pressure, sugar checked. And so we are providing food for them, drinks for them, and we're just having a great health fair day, true health fair where you can come in and get free health care. And again, that's just keeping BR healthy, and then allowing the families to be able to get care because they don't have access or they don't have coverage. So it's really, really a great event.
My name is Royal Evans, and I am 8 years old. Okay, today I've been experiencing me helping. Well, what made me want to help was I'm not from Louisiana, I'm from Texas, and in Texas, something very bad happened with me and another student in my school. I've been giving out bags of tea that my grandmother, Margaret Evans, she's gave us the chance to make the bags.
I am here helping to serve the community of Baton Rouge for all of our vulnerable populations, really and truly making sure that they have access to the needed health care that they need. It's so very important because we have so many different chronic illnesses that our community is dealing with. Very large portion of our population have issues with access to care. And so it's very important that we as the community healthcare providers, more importantly, bring that access to care and be that touching point that our patients need for us. Yes, this has been quite a journey. We have been planning this for months on end, and a big portion of this is our volunteers. We could not have done any of this without all of our amazing volunteers from all of the medical doctors, the dentists, the nurses, all of our registration volunteers. This is definitely a huge community effort, and we were able to get over 800 volunteers to help us to come out to serve over 1,000 people. So it's been very instrumental and something that's definitely needed in the community.
Councilwoman Chana Banks has joined us at the Baton Rouge Free Clinic today. So Councilwoman, tell me, you've been here last year?
Yes.
Tell me what you thought when you drove up on the parking lot this year. What did you see?
I saw a line of very enthusiastic people who are waiting for services, some probably no telling how long. When I tell you, to be honest, my initial response and thoughts were, this is a blessing and a curse at the same time.
I agree with you.
Certainly it is a blessing for people to be served as it relates to, dental, eye, and all kind of medical issues. But the fact that we have people who are lined up in hot weather, cold weather, all kind of conditions to get these services, in a way to say that this is America, that is one of the richest countries, we shouldn't have that. And so when I came in, I'm thinking, this is awesome. It's a seed, though. I think that we all on the Metro Council, our mayor's office, we really need to work where this is not something that happens once a year, but that people get those services all the time.
And I agree with you, because when we came up this morning, there were people that had spent the night. One gentleman was lying on the sidewalk, wrapped up in a blanket, had been here all night because he needed dental work. And so, again, this is something that we're hoping to be able to do on an annual or semi-annual basis. Mm-hmm. So what do you think more needs to be happening from the state level, local level, or how can we partner to make this better?
Well, one of the things, absolutely it needs to be a federal, state, and local issue. I don't see representative from the health department, but I think that there are probably a lot of grants that we need to tap into. I know this is part of a huger collaboration, but it needs to be a nonprofit that stands alone. Mm-hmm. And all year, we hope that the health community will give and participate, and we recruit professionals that will give these 2 days of service so people can get. I think the number one thing that people don't get, and for the most part is our out-of-pocket expense, is dental.
Yes.
Dental is expensive. Dental is something you get a loan for.
Yeah.
And
I
so,
have one.
yeah, exactly.
Okay, yeah.
And so I think that, the need for dental services is profound. We hear a lot about primary care and other wellness projects, but dental, that's something that is often overlooked. And so until you have a toothache, and then when the toothache, you may pull it, but still there are other teeth that need all kind of services. So I just want to commend you on this venture. It's huge. And all the partners that are here, everybody's really in a great spirit, a great mindset to help. And you see a myriad of people from all walks of life, and that are proudly wearing these shirts. And, again, thank you so much. And I hope from now in 365 days, not only will we be announcing another one of these events, but we talk about the increase of healthcare as a result of your efforts.
And that's the goal of the clinic, is not for just 2 days, but to be able to connect people with ongoing healthcare, ongoing vision, dental, and medical services, or whatever those services it may be. Absolutely. So thank you for coming out. Thank you for your support. You were here to support us last year.
Thank you.
We appreciate it. So thank you so much.
You too. See you later.
I'm Tracy Smith, Community Relations Representative with Healthy Blue. We are one of the Healthy Louisiana plans providing Medicaid and Medicaid expansion through this beautiful state of Louisiana. And so we're proud sponsors at the Love Hills Clinic and on this beautiful Friday. And we're just excited to be here. Man, there's so many people. I went outside, I checked the line, and I put myself in their shoes. It could be me, it could be my mom, it could be one of my family members. And so it just keeps me with a spirit of humility. And today we're all here for purpose. a purpose to serve. And so my goal is to be here with Healthy Blue and serve with a spirit of excellence because, again, it could be one of us. So I'm grateful for all of the organizations, doctors, dentists, everyone, the volunteers that are coming together to make this day possible. I had a child my junior year in college, and yeah, I was on Medicaid. And so it just gave me a greater appreciation to serve the community because you don't know where you're going to be. You know, some of us are one paycheck from being homeless, and so we need to be grateful for where we are, but then also never forget where you come from. And so it's about serving, again, keeping the spirit of humbleness and do what we need to do to improve others' lives. I'm a volunteer with Metro Health, with HIV/AIDS, re-entry, returning citizens. Criminal justice reform is huge right now. Another organization is the Butterfly Society, where we fight against domestic violence. And so, again, for today with Healthy Blue, what we do, we understand healthcare is very important, but we do understand that there's other barriers that people go through. And sometimes healthcare can be the last thing on their mind. And again, you know, they may be trying to find out where can I get something to eat. So we try to make sure that we educate them on the nearest food pantries, or, you know, where can I get utility assistance and things of that nature. And so we try to be a one-stop shop because, again, there's so many things that affects healthcare, transportation, education, housing, employment, all of that great stuff. And so we want to make sure that we are serving, again, in a spirit of excellence to ensure that we meet the needs of those that are here today. I did this last year, yes, and I volunteered, and again, it was a very humbling experience. Truly enjoyed it. There were some people that just came and they just needed prayer. So again, when you're talking about love heals, it truly does, and that's what we're here today, to just show that spirit of love and that spirit of excellence in serving, and just grateful to be here.
So we're here again on Saturday, the 16th, with day 2 of Baton Rouge Free Clinic. And I have one of my major sponsors here joining me this morning, my good friend and classmate, Mr. Will Johnson. So Will, tell me why Energy decides to get involved in this great effort.
Well, Energy powers life, and this is life. This is people who are in need, people who are low income, but people just the same. So to reach out to the community and be a part of it and assisting such a wonderful council person as yourself, that's very, very easy for Energy to reach out and do this.
So this is Energy's second year doing this. And so, Will, tell me about what you thought about when you drove on the parking lot.
Well, to see this many people waiting in line is just remarkable. We live in a rich country, but this is a testament to that we have so many people that are in need. And Energy recognizes that, and being a corporate sponsor and being a community focused, it's just natural to be here.
So I'm great. So Will and I are good friends, and so at Christmas time we have this special thing going where we always assist Santa with his sleigh every year. So you are who? He's Dancer.
I'm Dancer this year.
I'm going to be Prancer this year, or Rudolph. So Will, thank you seriously from the bottom of my heart for Energy's commitment and your commitment, not only for this effort in the community, but for everything that you do to help the council and everybody in the community. So thank you to Energy. Thank you to your corporate sponsors, and you can pass this great thank you on. But we really sincerely appreciate all that you guys do to help the community.
Well, thank you so very much, and thank you for letting Energy be a part of it.
We'll look forward to you guys being a part next year.
We'll be here.
We're going to try to make this an annual event and grow it every year so we can depend on you, right?
Absolutely.
Got you on tape. Thank you. Thank you.
We're so excited to be here. Louisiana Healthcare Connections is the premier sponsor for the Baton Rouge Free Clinic. We are the leading Medicaid organization here in the state of Louisiana, servicing the entire parish of East Baton Rouge. We applaud Councilwoman Donna Collins Lewis and the city parish for bringing this very important health initiative here to the city. This is our second year as the premier sponsor, and we are proud to be a part of this wonderful event. Today's access to care means so much for the citizens and the individuals around the community of Baton Rouge. So many individuals and families often have to choose between medical services and medications, as well as family basic needs such as food, shelter. So when we have events such as the Baton Rouge Free Clinic, it just brings so much joy along with services to those that are in need. Last year was an amazing experience. We saw over 1,400 individuals and families, and so this year I anticipate it to be very much the same. We've been here since about 5:30 this morning. Drove up to lines of individuals that have been standing out, I'm told, as early as 2 a.m. in the morning. So we are here as a health plan to not only provide the financial support of this event, but we're here as a community partner. We're here to let the members, as our members, as well as the community know that we are invested in bringing health and transforming health across the state. The communications around this effort has been tremendous across the entire city parish. We have partnered closely with Donna Collins Lewis as well as the city of Baton Rouge to ensure that the message was out. We've done our very best to be the corporate sponsor and the community investor that we could be. As a health plan, it is important that we champion causes like Baton Rouge Free Clinic so that we can ensure that individuals have access to care and not that it's a one-off experience. We want individuals to be connected to care. So not only today are you receiving medical, dental, and vision services, but you also have an opportunity to connect to Medicaid services, learn more about Medicare Advantage Plan programs. So hopefully today when individuals come, not only do you receive your service today, but you're also going to walk away being connected to a healthcare provider. This event means a great deal to Louisiana Healthcare Connections. We are beyond a corporate sponsor. We are invested in this initiative. We see the great outcomes and we want to be a part of that. And we're proud to be a part.
So you guys are here at the Baton Rouge Free Clinic for the probably second year. So tell me, why are you guys here? Why did you come out? Why did you feel that this was important to be here?
Well, we really have few times to come out as a whole community and take care of our people. So why would, we're at Care South, we're an FQHC, we're a health center. We want to take care of people who can't maybe make that happen for themselves. So this is the exact kind of place we want to be. This is the kind of thing that we want to do every day of the week, not just once a year. So take that back to everyone. We need this more often.
So what are you guys doing over here at your table? Tell us a little bit about what's going on at the table here.
Yeah, so at the table, we're basically just making sure people are aware of our dental services, podiatry, family planning, family practice medicine, pediatrics, behavioral health, Ryan White HIV services. We just want to make sure people know that we're here for them and that we can set them up with care right here. We're also doing free HIV rapid tests on the other side of the building.
So you guys are going to be able to connect people with services after today and tomorrow.
Exactly. So if someone's here and they find that they have some critical medical need or they just want to make sure their health is up to date, we can immediately set them up with a provider that is going to be able to follow up with them. We're really fortunate that the medical director here, Dr. Fowler, is actually one of our providers at our clinic.
Wonderful lady.
She is fabulous, and we are so lucky to have her, and the Baton Rouge Free Clinic is so lucky to have her. So I know that that's just going to be really wonderful so they can see her, they can see some of the other great providers, and then they probably some people saw some of our other providers today.
So people can leave here and actually go and get connected with services, Care South.
Exactly.
And that is the goal of the clinic, not just today and tomorrow, but to connect people with services for ongoing healthy living.
Exactly, because healthcare isn't a single point need. Healthcare is our life. We live our health. And if we're not living our health proactively, we're living our health reactively. And who wants to be reactive about living long so they can take care of their kids, they can take care of their partner, they can take care of their mama, where we need to take care of us so we can love the people that love us.
So thank you guys for being here. Did you want to add anything to that?
No, thank you.
She said no, thank you. Okay, thank you. So where are we going next? Let's see. I don't know. These people may run me from over here by the eyeglasses, but we're going to come this way anyway. Okay, look at these wonderful people trying on frames. Is that your style? Is that your style?
It's hard for me to decide, but they're great. It's all different kinds. It's so many to choose.
So many of them. So which ones do you like best?
I may go with the EXOs.
Okay. I like those too.
A great selection.
So tell me what you think about this clinic.
I think it's wonderful. It's great for people who can't afford what they need and a good way to get help with things like I really needed glasses. And I'm just glad that I was able to come and get some. Yes, ma'am. Thank you all so much. Oh, yeah, because it was a long wait, but, it's worth it. Yes, ma'am.
I have insurance, and I paid $300 for my eyeglasses, so it's even with insurance. So, yeah, it's well worth the wait. So
ma'am, thank you so much. I appreciate you.
There is always a huge need, especially when it comes to dental care, whether it's access to care or the cost, dental care. Some people can't afford insurance, and that's why it's important for us, to give back and to continue to help those that are in need of dental services. So, today my wife and I, we decided to close our clinic and bring the whole staff so that we can all, give back to our community. I think so far today I may have seen 8 patients. So we're able to get all of those patients out of pain. So it's always important to know if you have pain, you can't function correctly. You're not, able to perform at your optimal level. So it's just important to us to make sure that we take care of those patients.
Initially, I thought that we would, butt heads and get in each other's way all the time, but it's not. It's actually a really good partnership. I'm able to ask him questions for my patients that have ortho needs and also need general dentistry work. And he's able to come over and ask me questions for his patients that are in need of ortho. So it's a pretty good relationship.
When I was considering, being a dental director, when they were looking for a director, I just kind of thought about being able to serve the people of North Baton Rouge, seeing that I grew up, the house we lived in is probably 2 or 3 miles down the road from here. So it was always, always looking for opportunities so I could come back and help the community. Yeah, because with an event of this size, you definitely need collaboration from multiple businesses and organizations and manpower, to make sure that you can pull it off effectively, because you want to be able to touch as many people as you can. So without the partnerships, without people donating their time and giving of themselves, it's definitely an event that we would not be able to put on. Well, I just want to say thank you to my team for coming today. Thank you to my wife for not fussing at me for going to all these meetings after hours and picking up our daughter from daycare. Thank you to my parents for keeping our baby right now, and my sister. And thanks to my team who's right here. This is Latavia. She's from New Roads, not far from here. This is Jasmine.
Cheneyville.
Cheneyville. And this is also Courtland from Zachary.
Okay, Felicia.
Yes.
Smith's Eye Care.
Yes.
Why are you here today?
We are here so that we can provide a much needed service to the community. We'd like to see these people who don't have the insurances or have the capability to get to the services that they need. So we shut our office down for 2 days to be here to provide a service. My whole staff is here. It's very important, especially for our older patients, our diabetic patients, to get these eye exams done. And this is the least that we can do for the community, So we're here, rolled up our sleeves, getting busy, doing what we got to do.
So, Felicia, were you here last year?
We were here last year. We saw
in the cold?
In the cold and other, it was cold. But we barreled through. We saw about 300 patients in vision. We saw adults. We saw children. We saw those that were underinsured, no insurance, whether they had private insurance, whatever they had, we were able to provide services for them. They had a thorough exam. They were able to get their glasses, and we dispensed the glasses. It was a wonderful opportunity for the community.
Okay, so what do we have going on here? Who's that handsome young doctor back there? Do you happen to know him?
I happen to know this handsome young doctor. That is my husband, Dr. Smith, that works with us at Dr. Smith's Eye Care. He is doing a thorough eye exam right now on this young lady, and he's telling her translator right now what's going on with her. After she's done here, she'll go to optical and get fitted for glasses of her choice. There's hundreds of choices of glasses that I'm sure she'll be pleased with, and she'll be ready, and we'll set her up. We'll give her information so that she can follow with us in a year. If she's able to follow with us in a year, that's great. If not, I'm sure we'll have this clinic again. She'll know where to find us.
Again, ongoing health care, connecting them with services beyond today and beyond the clinic.
Open Healthcare Clinic is a federal qualified health center that provides medical, dental, and behavioral health services for everyone. Everyone is in need to get a service, it's a welcome to Open Healthcare Clinic. The amazing thing of our center is everyone comes to our doors will be served, regardless health insurance, regardless income, regardless. Everyone comes to this health center will be served by medical, dental, or behavioral health. The good thing of Open Health is that medical and behavioral health, they work together. Many of our patients are under both services, and we can see the successful being together because sometimes patients can have a primary care somewhere and behavioral health care somewhere else. And for them being between those, taking two types of medications, having two types of directions, I can see being at the clinic every day, I can tell you, make them tired, confused, and sometimes they say, I'm just tired. I got my medical appointment 3 days ago. Today I have my other appointment. I don't like to go. I feel so tired. I'm confused. Sometimes they get confused. Then when before Open Health opens the door, because I heard what my board of the directors were talking about, they decide what we put together. And it's what they're doing, and it's great. I can tell you because I'm there. Yes, it is so good. And they try to make appointments the same day, and sometimes the nurse walks from one specialist to another one, and then they cover the patients. I can tell you, yes, it's good. Open Health, born in 2016, but behind Open Health there is HEART. There's a big organization. You know about HEART. Okay, HEART works with HIV and STDs. HEART is still being hard, and we're still having free testing for HIV and STDs. All services are free at HEART. But also here in Open Health, being a health center, they test, but they do all the stuff. Okay, STDs or HIV with mental health, with primary care, all of them in one building. It's great.
Well, an area health education center has its primary focus of helping our population with rural health providers. But in connection with that, they participated in a grant with Southwest Education Center, Area Health Education Center, and obtained a grant several years ago under the direction of the Southwest Director, Brian Burton. A grant was obtained to hire people like me as navigators for health insurance. We're federal navigators, and our role is to assist people with enrollment in health coverage through the federal marketplace. There are numerous plans with various deductibles, co-pays, and monthly premiums that a person can select whichever one they want. And as far as keeping your own doctor, you can look to see if your doctor's in a plan, and you can keep your plan, your doctor, and so on. We're hoping to get the word out. We have 5 navigators in the state right now, and I'm one of them. We have one in Lafayette, one in Lake Charles, one in Shreveport, and I actually have 2 in Lake Charles. One of them is our supervisor. But our job is to get the word out and try to help people enroll. It does get a little complicated and tricky at times, and we're used to dealing with it. Not that we know everything, because I sure don't, but if we don't know the answer, we try to find it out and help people.
My name is Evelyn Gibson. I'm with Family Service of Greater Baton Rouge. We're a counseling agency. We do individual counseling, group counseling, child custody evaluation, supervised visitation, domestic abuse intervention. We have parenting classes. We also offer free HIV, syphilis, and hepatitis C testing. We've been around since 1955. We're under the United Way umbrella. I always say everybody knows somebody that uses services at Family Service of Greater Baton Rouge. Oh, I think it's great that everybody coming together, people from all over Texas, New Orleans, coming here to volunteer to help people obtain services that they couldn't get otherwise. I think that's great. That is great.
Well, I'm here representing the LSU Ag Center. We're here promoting health and wellness, encouraging people to eat a variety of different foods from my plate, and also to be physically active. What we do is we encourage people to eat a variety, to choose my plate. And when I say choose my plate, the USDA gave us a guide to follow. It's called My Plate, and it has 5 different food groups. And we encourage people to eat all 5 of those different food groups daily, but to portion their foods. So we're not specifically telling them, well, eat this, eat that. We want them to eat all 5 of the different food groups. Make half of their plate fruits and vegetables. Select half of their grains when they eat grains. Make them whole grains. When they eat protein, select the leaner portions of protein. Select low fat or no fat dairy foods so that they can get all the nutrients that they need, and they can limit some of the things that they don't need, like the fats and the sodium and the added sugar. I think it's going really well, and I'm really happy about the people that's coming and inquiring about information, even the ones that's seeing the dentist. Now that they maybe had to extract a tooth, they come and, well, what can I do to be healthy, or what can I do to maintain my health? And now that they don't have some teeth, well, you know, with the food, they still can eat a variety of foods, but just maybe prepare it a different way. Maybe puree it, but it's no reason that they still can't get the nutrients from the foods that they eat.
I'm here today representing True Care Health and Wellness, and we're here serving today as Lifestyle Director. And lifestyle is everything. You're born with genetics, you cannot change, but lifestyle is the key to making the most of those genetics that you have. It's kind of like genetics might be the brush fire where you get a bad set, but lifestyle is the extinguisher that puts out the fire. So when we make healthy choices, when we get enough rest, when we get out in the environment, experience the sunshine and the air, when we get active and move around and keep a good attitude and trust in divine health, these are key principles that help to ensure that we have positive health outcomes. And so that's what we're here to do today. A little time to make a big bang and pushing health, pushing lifestyle as a way to go as far as healthy outcomes and healthy and well-being.
You can't move. You can't run nowhere. This is Pamela Smith, my legislative assistant. My left hand, my right hand. So Pam, why you here today? Why you hanging with the councilwoman when you could be doing something else on your day off? Because this is really Pam's day off on a Friday. So Pam, why you here?
Well, this is an awesome event that the councilwoman brought to Baton Rouge, and I just love to see all the people that come in and get teeth removal. Get vision, get glasses. It's just an awesome event. And I just love working here and looking at all this going on.
What does this mean to you, and what are you guys doing here in the section here?
It means to me we're coming back, giving back to my community and helping others, and along with my classmates. Supporting the vision, taking care of the community is just what we do.
So what are you guys doing right here at this lifestyle area?
What we're doing at the lifestyle area is we're meeting with people, trying to find out the resources that they need concerning their health, concerning good eating, concerning all of the needs that they will need to have a productive lifestyle.
Great. So like I said, the goal of the clinic is to connect people with the resources past the clinic so they can continue to have and live a healthy life. So, Yolanda, thanks for what you guys are doing.
It's a pleasure working with you.
Appreciate you.
Love you.
Tell us a little bit more about what you guys do.
Well, our job is to work with the community, work with the city, work with yourselves, and introduce people to health studies, clinical trials where they can also stay healthy and make money from Pennington Biomedical Research also. So we pay you to participate in our studies. And our studies from seniors to women's studies, children's studies, African-American studies, everyone's involved can be partaking in it.
Okay, so how does somebody want to do a study? How do they get involved?
They can come see me. If you come see me, you can come. I'll be at a table, or you can call me at pbrc.edu, and I will sign you up to participate in the study.
Great. So again, you can see the theme that's flowing throughout the clinic is connecting people with services beyond today. So Pennington is another great place where we can connect people for studies. And this also helps them to understand some of the things that are going on with them health-wise, right?
That's key. That's the key. I always tell people, know your numbers. That's the important thing. Once you know your numbers, then now you can take care of yourself and manage your health.
Okay, I don't know my numbers, but I'm going to close on that note, though. Thank you. Okay, so Frankie.
Yes.
Thank you for being here, first of all, at
Well,
the Baton
thank
Rouge
you.
Free Clinic. So tell me, what made you guys be here today? Why are you here?
Well, I am with the Communities of Color Network through the Southern University Ag Land Grant Campus, and we are involved with an educational awareness program where we let people know about the dangers of tobacco use, secondhand smoke, and we also offer information where people can get free help with trying to quit smoking. It'll pay for medicines, for counseling, and for coaching. And so we're just here today to let people take advantage of that opportunity, and we are enrolling people in the program today. They will get a card that looks like a credit card that they can take to, along with any prescription, to any drugstore, and they will provide the medication free of charge.
Okay. So again, you can still see the thing that's running through here. So you guys can have people come over. They can come get an application today.
Yes, actually, I will complete the application today, and it's very simple. The only information that I would need would be their name, address, date of birth, and telephone number. And then in about 7 to 10 days, they would get the information where they could, where they would get the card that they can take to get the free medicines to help them quit smoking.
I'm representing AmeriHealth Caritas of Louisiana. We're one of the Healthy Louisiana plans. We're here supporting the Baton Rouge Free Clinic. This is our 3rd year supporting this Baton Rouge Free Clinic. It has traveled from here for the last 2 years. We were in New Orleans on the 1st year. We are providing this, supporting this actual event. Caritas is a word, it's a Latin word that stands for care. And one thing that we do at AmeriHealth Caritas is we always force and instill in the people that visit our tables or in the community that care is the heart of our work. And it also aligns with our mission, and our mission is for individuals to get care, stay well, and build healthy communities.
So Representative Smith, thank you so much for joining me for the Baton Rouge Free Clinic. So tell me what you saw when you put up on the parking lot today.
Well, I saw the sea of cars, and then I saw the sea of people. And then when I came in, I realized that this is indicative of the issues that we have with our people as far as health care. It is wonderful, and I really thank you for putting this on again for the 2nd year. I see that there's a total need for this. We have many of our MCOs from the state that are here working with people on their health issues, but I can tell you that you need more help. And I'm going to work on getting you some help. I'm going to see how we can financially support you through LDH even more, because I think that when people can't get in to see a Medicaid doctor, that this shows that they need the care, and folks are getting that care here in a free clinic. And I just think that it's wonderful, because if people aren't healthy, they can't work. They don't have quality of life. And so therefore, this is what we need. So thank you again. Thank you, thank you, thank you. This is tremendous.
So thank you for coming out. And so we are going to work on doing this again for next year. And so talk about some of the people that you've kind of been able to engage with, and as we look around and span the room. So what do you see on some of the faces? What do you think people are thinking as they're able to come in?
They're thinking, in my opinion, when I see them, oh, I'm getting something done today. Something that I really needed done maybe for quite some time. I see joy, I see smiles, I see children, I see folks that I know here that are getting health care, and I'm just ecstatic that they're here. So it's just 1 day, 2 days of individuals being able to really realize that healthcare is so important, and that you've been able to provide something for them to get it.
So thank you. You touched on something really important. The goal of this clinic, and you said about the MCOs are here, so the goal of the clinic is to be able to connect people, and so that's one of the things that we're also hoping to do, because some people, even though they may have the health care, they really don't know what they have. So talk just a little bit about those agencies.
Exactly. The MCOs are actually supposed to be companies that reach out to individuals who are on Medicaid and get them to sign up for the services that they need through the state, through LDH. That's what Medicaid expansion is all about, being able to get those MCOs to reach those individuals who have health care needs. And we find that oftentimes doctors are not taking Medicaid. So we're having a shortage of doctors that aren't seeing people. So this is an opportunity for them to come out, even sign people up for the care that they need in their MCOs if they're not already signed up.
Yes, great, thank you. And so that's what we're working on. But I really appreciate you coming out. So Representative Smith has committed to helping us next year, so we are going to do this. We're going to try to make this an annual event. And again, we only know it's for 2 days, but just like you said, some of the people that have come out today would not have otherwise been able to get this. We've had people to come out and tell us, I've had a toothache for over a year. I had teeth that needed to be pulled. And so even though this is a small event in some ways, it's a big deal for a lot of people.
It really is. And I think that we need to start early in making sure that folks like LSU Dental, I'm going to call out names, LSU Dental.
No, I gotta give them a shout out. They were here with us last year.
Yeah,
There were some
right.
events happening with dental
Exactly.
students this weekend,
Right.
and they couldn't make it, but LSU was a great partner last
Right.
year.
And making sure that our dentists who are just give a day of service to individuals, because that's what it's all about. Everybody can give back. You can write it off on their taxes.
Yeah.
So it's so important that they just give back to the community that one day.
Yeah, so
and,
we're
and
gonna
help
start,
out.
Yeah, we're gonna
Yes.
just like you said, we're gonna start early recruiting next year.
Exactly. And put that date on the calendar, and not just have people sign up, but show up.
That's it. Thank you very much. Love you.
Okay. You too.